Last bit about this chapter, about everything that has to do with the central nervous system, brain, and all that goodness, is the 12 cranial nerves. The cranial nerves don't need your spinal cord. They don't innervate the spinal cord. They come off at some point off of your midbrain, your brainstem, your pons, what have you. And they're ordered numerically from superior, or the most dorsal, down to the most ventral of your nerves. There's a couple of acronyms out there that help you remember all that wonderfulness, but we're going to go ahead and just name these out, and then we'll visit those acronyms. First off, a couple of notes. They can either be sensory, motor, or both, and you do need to know their function. It is important that you know their function. Again, there's the 12 things right there. I'm going to go ahead and post these slides at a different point, but we are not going to read this word for word. That is a waste of time, and nor is it helpful. I am going to use this acronym throughout this presentation to help remember what order you're in and hopefully help you remember the stuff, but this is a little mnemonic to help remember those cranial nerves. I will perform my crazy little rant here at the end to hope y'all can just wait with bated breath to hear that wonderfulness, but here we go. First off, the olfactory nerve. Olfactory goodness. Olfactory refers to smell. Now, those of you that might remember how much I loved and enjoyed that cribriform plate, look where that olfactory nerve is innervating. It's innervating nerves coming up from the very tippy top of your nasal cavity and innervating into that olfactory tract, that olfactory nerve. So how do we test it? Well, that's silly. That is via smell. So this gentleman here is being exposed to a different type of smell that he's not aware of. He's closed his eyes, he's closed one nostril, he's just testing one side of that olfactory nerve, one side of his hemisphere to make certain that it's operational. And he is going to tell that doctor what he smells. If it smells weird or different and it's not the same as what's been labeled, and he often does that mistake, there's probably some damage there. If he smells nothing at all, even though he has a nice, clean, clear nose, no issues, no whatsoever, no cold, then most likely that is completely damaged or severed or broken. The second one is your optic nerve. Optic means sight. Notice where this nerve is coming off. You got the optic chiasm here. This is an important key where you get that bridge in between the eyeballs and goes to the opposite side of your brain. So you got the left eyeballs coming into the right hemisphere, and the left eyeball's information is coming into the right eyeball is coming into the left eyeball is coming into the right because of that optic chiasm. Now, how do we test it? Well, that one's actually kind of a little bit easier to do. You already have the Snell charts, you have the astigmatism charts, you have all that wonderfulness. The third one is called the oculomotor. It innervates quite a few different places. You got the superior rectus, the inferior rectus, your iris, as well as your ability to focus. Now, how do we test that? If it's innervating that iris, the iris has a lot to do with the dilation and constriction of your pupil. If you have damaged that oculomotor tract, guess what? You are not going to be able to force a constriction of a very heavily dilated pupil. That nerve has been broken. Another way to check is just to have them look around the room. Here is a gentleman here that has had his oculomotor tract damaged. This is from Stanford University School of Medicine. Now, notice here, this is straight. We're going to be using pictures like this all the way throughout this next portion of this presentation. And it's all using the same thing. This one right here in the middle is the patient has been asked to look forward. The patient's been asked to look up in this one, up to their right, up to their right, down, down left, left, and then up left. Notice at this frontal view that he is not able to really do much with it. He can't look up. He can kind of look down. He's looking down just fine, but he can't adduct it. He can't really do very well with looking up. The fourth one is your trochlear. This is where you're going to go ahead. It's kind of hard to do the little eye test with them here, but you still can see it. You can see that just like if you see here, this little H, if they're going to look down with either eyeball into this region, they're going to have that difficult time looking over. Notice how this has become deviated here. One other thing that you can test for is the head tilt. This gentleman's eye is looking straight forward. He's looking straight forward. His head's not off to the side, which means that that iris is up a little ways. Now, because of this, he's probably seeing double vision right now. And people that have trochlear damage or have some type of congenital issue with the trochlear nerve is going to hold their head off at a tilt to help compensate for that double vision, make that double vision go away. The trigeminal, this is where you'll notice that has some sensory issues up here, or some sensory capabilities here and here, but also has a lot of motor function. Look how it's innervated the temporalis, the masseter, and other things along with it. So the way to test it is you're going to have them clench their jaws shut and you're going to try and pull it open. If you're able to do it, then maybe there's you either don't know your own strength, or that side that's affected is going to open up slightly with ease. Finally, the last nerve, or the cranial nerve, that has something to do with the eyeball is the abducens. If you're remembering back to our directional anatomy, abduct means to move away laterally. So if you're abducting your arm, you're spraying it out and ready to fly like a glider or an airplane. How you test it, you're going to go ahead and have them look off to their sides. So this young lady right here, this is from a picture from the University of Iowa. There she is looking forward. This is her looking after the sides, and then they get to this one right here. This is indicative that her left abducens has been damaged or severed because she can't abduct it. We are now more than halfway through our discussion of your cranial nerves. Let's go ahead and move on to the facial. Facial nerves has a lot to do with expression, has a lot to do with taste, as well as the production of tears and saliva. The easiest way to test to see if there is something wrong is just to have the person smile. This is a gentleman here before his facial nerve got damaged, and this is after. You ask him to smile, and only half of his face responds. This is your vestibulocochlear nerve, aka this has also been formerly known as your auditory. They changed the name auditory, which is hearing, to the vestibulocochlear because there's a little bit extra going on inside that little auditory canal. We'll be talking about that when we get to the senses, but I'm going to go ahead and give you the very basics of it. The vestibule is your sense of balance, while your cochlea has more of your hearing. Hence why, and you can see that it innervates both of these things. That's why they had to change it just from auditory to that vestibulocochlear. They had to take into consideration that it has that balance going on in here. Hence the vestibule cochlea nerve. How to test it? Well, you're going to go ahead and rub your fingers together and get closer and closer and closer until you actually hear that rubbing. If they don't hear that rubbing, there might be something wrong with that nerve. Obviously, more testing would need to be done. Finally, you got the not quite finally. We got a few more to go. The glossopharyngeal. Glosso refers to mouth. Pharyngeal is the back portion of your mouth called the pharynx. These guys innervate your salivary gland. It innervates some of your motor function, soft palate, and sensory, all that goodness. And it has a lot to do with sensing your blood pressure. It has a third of your taste buds, the back portion of your taste buds, as well as some swallowing going on. So how do you test it? Well, there's a couple things you can do. You can put a little bit of a sour, pungent taste on the back of the tongue to see, on either side of the tongue, to see if it responds and if they can taste it. If they can't, darn it. Another thing is you can take a cotton swab and push it to the back of their throat and push down. If they have a gag reflex on the suspected damaged side, then hey, maybe it's not damaged. Or maybe it's just partially damaged. But if they don't have that gag reflex and they haven't trained to not have that gag reflex, then you probably should suspect something's wrong with that glossopharyngeal nerve. The vagus nerve. This is one that you should be very, 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 very familiar with because it is going to crop up so many times it's not even funny in your studies of the digestive system, the respiratory system, your cardiovascular system. This is a buddy. You need to know about it. Even though it says what happens in Vegas stays in Vegas, you need to know. Dad joke. Moving on. So a lot of it is your parasympathetic response for all of this. Not only for your hearts and lungs, it is your rest and digest phase. It innervates your stomach. It innervates your small and large intestines. It makes them work. It helps regulate them to work, I should say. It has a lot of your respiratory tract breathing normal. It's also checking your pH, your pressure of your blood, and all that wonderfulness. And it has a lot to do with, it also innervates your voice box. So it helps out a lot with speaking. In the trunk, aka your thoracic and abdominal pelvic cavities, it has a lot to do with sensing how it feels, its intestinal motility, as well as help with secretion. And it also has a lot to do with swallowing, aka if you suspect something's wrong with the vagal nerves and you see the low vasoconstriction or the low blood pressure, you're seeing the low heart rate, and you want to make certain it's not the vagus nerve, all you have to do is tell them to swallow. If they can swallow, then it's not the vagus nerve damaged, most likely. If they can't swallow, then maybe you should be suspecting something's wrong with the vagus nerve. 2 more to go. Accessory. The accessory nerve. How do you test it? Look where it's innervating your sternocleidomastoid and your trapezius. So how do you innervate? Do you check it? I don't know. Okay, really, it's just ask the patient to shrug their shoulders. If they can shrug them, then hey, that accessory nerve is A-okay. Finally, the last one is your hypoglossal. This does a lot. It innervates your tongue, and it helps you move that tongue. It is the nerve that moves your tongue. You damage this one, you're not moving your tongue. So tell them to speak. Also, something else, if they probably can still speak if one of the nerves is in contact with a little bit of a problem. Another way to test is to have them stick out their tongue. If one of those nerves is affected, that tongue is not going to be able to constrict on that side. And the one side that can is usually used to pushing up against that muscle. Without that muscle pushing back, you're going to have that side stick out of their tongue, and they can't stop it from happening. So that is the 12 cranial nerves. Here are some ways to help you remember some ideas. There's 2 mnemonics that we care about. Mnemonics is just taking the first letter from each of these nerves, the olfactory, optic, ocular, motor, O, T, T, A, F, A, G, V, A, H. There's this one right here that was the first way I learned it. It's on Old Olympus, towering tops of Finn and German, view a hops. Hops is beer. Or there's this one that was recently introduced to me by the book. I really enjoy it because I don't know, just the weird way to say it just really sticks it in. I'm going to go ahead and give you, as promised, give you that weird noise. Oh. Oh, to touch and feel very green vegetables. Oh. Yeah, all those are ways to mnemonics to help you remember what they are. O, olfactory, optic, oculomotor. 2, trochlear, touch, trigeminal, and abducens, feel, facial, vestibulocochlear, very, green, glossopharyngeal, vegetables, vagus, accessory, and H, hypoglossal. Now, there's other ways to help you remember the functionality of it, the functioning of how they work. Now, one of these is to draw a face and put the numbers of those, what they do, what these nerves do, into those positions. For instance, 1 you see is on the nose. Optic nerve you see is on 2, is on the eyeballs. 3, it's surrounding that eyeball, that raising the eyebrows, moving your eyes all over the place. 4 is your trochlear. Remember, it's that guy that has to put his head off to the side a little bit and has a difficulty seeing in between, or those you can see that the eye is off when you look down and adduct it. That's why that 4 is there. If I were me, I would put it as like the tear duct. 5 is your facial, not facial, trigeminal. Remember, trigeminal has to do a lot with chewing and sensation, so that's why they put it as part of the mouth. 6 is abducens. You can't look off to the side. I would put that 6 and turn it on its side. Make it one of those smiling wrinkles that you do when you smile really, really big. 7 is facial. Notice that 7 is that border. This is your facial expressions. 8 is your vestibulocochlear, aka your hearing, so they put that 8 as an ear. 9 is the glossopharyngeal, so that sour taste in the back of the throat. Your vomiting, your gag reflex, so if you stick something back there, you get that gag reflex. 10 is your speaking. It's also your swallowing. It is also that really parasympathetic thing where it regulates a lot of the parasympathetic actions of your trunk. 11, accessory. It's, remember, the I don't know thing. And 12 is the hypoglossal, which controls your tongue muscles, and you're going to have them stick out their tongue. Now, another way to help you remember just general sensory, motor, or both is this little acronym here that says, some say marry money, but my brothers say big brains matter more. Let's go ahead and transfer that underneath this little mnemonic of the OOO. Some, if it's an S, equals sensory. If it's an M, equals motor. And if it's a B, it means that you're having sensory and motor going on in these cranial nerves. So some, since it starts off with an S, says it's sensory only, which makes sense. It's olfactory. You're only doing smell. Say starts with an S. It's an optic. It makes sense. You're just doing the visual. Marry, oculomotor. You're moving a lot of that eye. A lot of those eye movements pertain to the oculomotor. No real sensory there. That's why it has the M. Money. Trochlear. It has a little bit of that eye movement, and that's about it. Trigeminal has that chewing, as well as that sensation of your face. So it's both. Abducens is motor. Facial is both. You have that smiling, as well as a lot of those pain and cold reflex sensations. Vestibulocochlear is purely somatosensory. Auditory / balance. Glossopharyngeal, you got both going on. You got the gag reflex, you got the taste, you got all that stuff. Vagus is both. That's like straightforward, no-brainer. You got some taste buds in the back of your epiglottis, as well as a lot of your regulation of your heart, your motility of your guts. Accessory is the I don't know, so you're shrugging your shoulders, so it's only a motor. And finally, a hypoglossal, you are moving your tongue. with that, that is it for the cranial nerves. Hopefully this little thing helps you out. Good luck. Enjoy. If it really helps, find some case studies where they explore the different types of cranial nerves and damage there. And maybe try and identify what's going on before you read on and they tell you the prognosis and diagnosis. With that, good luck and carry on.